You used eardrops expecting relief, but instead your ear feels even more blocked. If this has happened to you, you're definitely not alone. It's one of the most common concerns people have when trying to deal with earwax at home. At first, it might seem like something has gone wrong, but in reality, this reaction is often completely normal. Eardrops are designed to soften earwax, not instantly remove it. When the drops enter your ear, they begin to break down and hydrate the wax. As the wax absorbs the liquid, it can expand slightly. This temporary swelling can make your ear feel more blocked. So even though the drops are doing their job, the sensation can feel worse before it gets better. Another thing that can happen is movement. As the wax softens, it may shift deeper into the ear canal or settle in a position that blocks sound more effectively. This can make your hearing feel more muffled or create a stronger sense of pressure. For some people, this can be surprising or even worrying, especially if they were expecting immediate improvement. It's also important to consider how much earwax is present. If there's a significant buildup, drops alone aren't enough. Instead, they prepare the wax for removal by softening it. This is why eardrops are often recommended before a professional appointment rather than as a complete solution. Another factor is how the drops are used. Using too much, using them too frequently, or not following the instructions properly can sometimes irritate the ear canal. This can add to the discomfort and make the ear feel even more blocked. So what should you do if your ear feels worse after using drops? First, don't panic. In many cases, this is a temporary stage in the process of softening the wax. Second, avoid trying to fix it with cotton buds or other objects. This can push the wax deeper and make the blockage more difficult to remove. If the blocked sensation continues or becomes uncomfortable, the best step is to have your ear checked by a professional. Microsuction is one of the safest and most effective methods for removing earwax. It allows an audiologist to gently remove the softened wax under direct vision, providing quick and controlled relief. At Hearing First Mill Hill, we often see patients who feel worse after using drops, but once the wax is removed, their hearing improves almost immediately. The key thing to remember is that eardrops are just one part of the process. If your ear still feels blocked, it doesn't mean they've failed. It usually means the wax is ready to be safely removed. If your ear still feels blocked, it doesn't mean they've failed. It usually means the wax is ready to be safely removed.